Doctor, in the situations I'm about to mention, should patients come to the clinic or not?
So, is it important or not?
Exactly. There is peeling and cracking around the lips.
If there are cracks that don't heal despite using cream during the winter months, they should come in.
Okay, what if small blisters appeared on the back of the hand but they weren't itchy?
Now, the blisters could be due to eczema, herpes, or a fungal infection. They definitely need to come in for a differential diagnosis. Especially if the symptoms last longer than a week, it's healthier to consult a doctor.
Hair is falling out, but sometimes it falls out very heavily in intervals. No hair loss periods.
Hair loss is an important symptom. Sometimes we see it in cases of iron deficiency, vitamin deficiency, or thyroid diseases. It can also be related to stress. Especially if hair loss lasts longer than 6 weeks, be sure to consult a doctor.
So what should we do if bruising occurs after a filler procedure?
The first 24 hours after a filler are important for us. Bruising is acceptable. It's among the possible complications, but there is a situation we worry about, such as the filler entering an artery. We call this occlusion, meaning blockage. In this case, instead of bruising, you see more whitening in a specific area, slight red veins, and severe pain. If you experience such symptoms, you should contact your doctor immediately. But bruising is not really a big problem.
So, doctor, there is some darkening of the skin under the armpit. Should she come in or not?
Darkening of the skin under the armpit is an appearance that bothers women a lot. It usually resolves on its own. Of course, if they want to get treatment for this, if it bothers them, because it's not really a medical issue, they might come in for aesthetic concerns.
Every month before my period, I start getting pimples along my jawline.
Before and during menstruation, it's normal to have a few pimples around the mouth area. If discoloration remains and these spots don't go away, it can bother the person. If they care about aesthetics, they might come in for treatment.
So, doctor, after being in the sun, I get slight redness on my face. Should I be concerned?
Mild redness indicates a first-degree sunburn. It can be managed by moisturizing frequently and applying a cold compress. But if blisters form or if there is fluid accumulation, they should seek treatment.
They encountered a mole that grew very rapidly.
This is a very important topic. New moles can appear over time. Let's mention this first. Sometimes patients say, "This mole wasn't here before, it appeared later." They may worry, wondering if it's something bad. Especially if a mole appears that looks different from the ones you usually see, different in type, color, or shape, and seems unusual, you should definitely come in. Apart from that, if an existing mole changes color very quickly, grows rapidly, starts to bleed, or develops roughness on its surface, these could actually indicate that the mole may be undergoing a malignant transformation. It is not possible for the patient to make a definitive diagnosis of this themselves. It is both healthy and necessary to definitely consult a doctor and have it examined with a special technique called dermoscopy.
All right, doctor, here comes the most critical question. They started using a spot cream, but their skin got even darker. The place selling the cream says that it gets darker first, then it heals.
This can sometimes happen with device-based procedures like lasers, but we don't expect this to happen with creams. If the cream is irritating the skin too much, it can darken the spot, or maybe the person isn't protecting themselves from the sun. The cream may also have made the skin a bit more sensitive. In that case, the irritated area may darken and the spot may become more pronounced. For the right cream choice, be sure to consult your doctor. Obtain the medication from pharmacies as well. Only doctors have the authority to prescribe medication and recommend treatments.
Thank you, doctor.
Thank you. I hope this has been helpful.